from today's session. Okay. So as we dive into the main meat of our session, I want you to, if you know somebody who should be here today, get them on this call. Okay. So copy the link, share it with them, get them on this call. We'll have an exciting time and we'll have the opportunity for Q&As before we wrap up today. Okay. So let's get right into the main meat of our session today. Okay. So how do you leave bedside care? How do you land jobs within health tech using your already existing knowledge and experience and also breaking into the space? So I'll show you four key things today. Four things. Number one is I'll show you how to convert your healthcare skills, your healthcare experience. So for those of you who are physician assistants, physician associates, you've worked as a nurse, a registered nurse, you've worked as a care worker, a physician, you want to be here. And for those of you that don't have experience in healthcare, maybe you have a master's in public health or you have no experience whatsoever, but you want to break into healthcare with roles like healthcare analyst and so on and so forth. I'll show you how to also break into the space within the space of 6 months. And what this means is you can still land a job in 2026. Okay, so I'll show you how to get that on the way. And of course, I'd also show you how to learn the skills required to land a job. Because wanting to break into a space is one thing. Knowing the skills required and how to learn those skills is another thing. And I'll show you the exact skills you need to get in, the skills you need to learn that enable you break in and land a job within the space of 6 months. And of course, I'd show you how to gain experience to show employers that you are the best candidate for the job. Okay. So your experience today, for a lot of people, it is 100%, bedside care. You are a nurse, for example, you are a doctor, you are a physician, you are a healthcare assistant, you are a care worker, a support worker, or you have no experience in healthcare. How do you show employers that you are the best candidate for the job? How do you show them what you have done, not telling them what you can do? Because in the world of work today, employers want to hire candidates that they are sure can do the job. So they don't want to hear what you can do. They want to see what you've done. How do you show them what you've done and the experience you bring to the table? And finally, I'll show you how to get started today. So today, the 18th of April, how do you start if you want to break into this space? So these are the four things I'll double down on today before we wrap up our session. So make sure you have a notepad, make sure you have a pen so you can jot things down and take things away from today's session. So why are we here? We know what the topic is, but the major reason why we are here is simply because we have so many people who are looking to break into the tech ecosystem and you have experience in healthcare, but you don't know what to do with it. So you're career switchers, you want to move into the tech ecosystem and you don't know what to do. And for some of you, there's a group of people here today who are burnt out. You are physically strained. You are tired of bedside care. You are exhausted. You don't have time for your family anymore. And you are so stressed out. You want to break and switch careers and you really don't know where to start. I was discussing with a lady this week, sometime I think on Wednesday. Her husband is in the US, she's in the UK, and she wants to move to the US to work, but she's a physician assistant in the UK and she wants to get a job outside healthcare. Okay, and she's looking to land a job as a clinical data analyst. And the question for her was, how do I learn the skills? I don't know what to do, but I know that I don't want to go to the US and become a physician associate. I want to get a job as a clinical data analyst or a healthcare analyst. If you're in that category, you are in the right session. Okay. We have a group of people who are your nurses, healthcare assistants, your care workers, support workers, medical doctors, and so on and so forth. You want to transition, but you're scared of starting over. You think you'd have to start from the beginning. You have to go right from the scratch, get an entry level role, but that's not the case. Okay. For some of you, you're on your pathway to ILR. You've done 3 years on your, health and care visa, your skilled worker visa, and you are thinking that if you get a job as a healthcare data analyst, it means that you'd have to start all over again, but that's not the case. You can continue your pathway to ILR and it doesn't stop anything whatsoever. Okay. So I'll show you how to get that sorted. And of course, like I mentioned earlier, you are in the right session. And for some of you, you have domain knowledge in healthcare. So you have experience. You've done some education, some masters in public health, and so on and so forth. So you have some knowledge and domain experience, but you don't know what to do with it. You don't know how to use it, especially as an advantage to break into tech. I want you to know that if you are in this session today and you have experience, you've worked in any capacity in healthcare, you have a gold mine in your hands and you're already 50%, you've done 50% of the job. So the next thing for you is just to equip yourself with the right skills to help you break into the tech ecosystem. And for those of you that don't have domain knowledge, I would also show you how to get domain knowledge. Okay, these are the things you also get to learn to help you transition. All right. So these are the major reasons why we are here today. And as we move on in our session, we'll break them down one after the other and so on. Okay. So don't forget, somebody that needs to be here, get them into today's session. Now, who are we at Analytics? For those of you joining us for the first time, Analytics is a leading educational technology company focused on helping people land high-paying jobs, especially within the tech ecosystem. We operate out of Alberta in Canada and also London in the UK. Over the last 5 years, we've helped over 4,000 people with no prior experience, no prior background in tech. We've helped them land their very first jobs within the tech ecosystem. We've helped nurses become healthcare reporting analysts. We've helped accountants become project managers. We've helped so many professionals in different career paths get into cybersecurity, healthcare business analysis, healthcare project management, and so on and so forth. And I'll show you how we've been able to do this over the last 5 years and how you can also do the same. We have 172 full-time employees, and of course, 300 plus industry experts, professionals who would work with you to ensure that you have a smooth transition. The areas we focus on majorly includes data analytics, health tech, especially within healthcare data analytics, healthcare project management, and healthcare business analysis. We have data science, financial analytics, cybersecurity, DevOps engineering, and so on and so forth. But the reason why we are here today is to discuss health tech, a career path that is exploding in demand across different regions. So how do you get into the health tech space? And of course, what area suits your own particular experience and your capabilities to do the job within that space? And I'll show you 3 career paths within the health tech space and the one that best suits you. So by the time I'm done explaining them, you would understand clearly the career path for you to move into and the one you're likely going to thrive and land a job before the end of 2026. So I'll be leading the session today. My name is Adeza Suleiman. For those of you meeting me for the first time, I'm a technology expert with over a decade experience cutting across management consulting, data analytics, data engineering, and so on. I'm the founder of Tenalytics and also the co-founder of Amdari. And using these 2 platforms, we've been able to help over 4,000 people with no prior knowledge, no prior background to transition and land their very first jobs in the tech ecosystem. Like many of you, I had no background in tech. My first degree was in industrial chemistry. When I got out of the university, my first job out of school was as a management consultant, but I was able to transition into data analytics. Today, I work as a data analytics and engineering contractor in Canada. I've worked and I've worked in the UK as a data science consultant, customer insights analyst. I've worked in the US, working remotely back when I was in Nigeria, working for companies in the US as a data analytics consultant. I've worked with one of the largest privately owned energy conglomerates in sub-Saharan Africa as a data analyst, management information systems analyst, and business data analyst. And I've worked for FITC, owned by the Bankers Committee and the Central Bank of Nigeria, as a data analytics consultant. My experience spans across sports, financial services, educational technology, automobile, and also the energy sector. So I'm going to share my experience as we move on, some of the mistakes that I made and how you should avoid those mistakes. And more importantly, my major role today is to show you a pathway as a mentor. I've worked as a mentor for the past 5 years to help people like myself to make that transition and break into the tech ecosystem without making the same mistakes that I made, accelerating your journey, you having a shorter learning timeline and helping you make that jump. All right. So my goal today is to ensure that by the end of our session, you know the right career path that you need to take in order to land a job in 2026. Okay, so we're going to dive in. For those of you, it doesn't matter where you are in Canada, you want to get a job that would give you accelerated pathways to PR. You are in the UK, you are currently in healthcare, you are a support worker, you are a care worker, you work with any organization in the UK, but you want to transition into a role where you can work from home, a remote job or hybrid role where you don't have to go to the office all the time, or you can work fully remotely. You have time to take care of your kids, you have time to spend with your family, and so on and so forth. If you are in the US and you're looking to break into the health tech space, you want to land a job, I'll show you the career path you need to focus on. Okay? Now, the health tech space itself, you have so many career paths within the space. And I'll show you some of the high demand career path you need to take note of. And of course, there's been an explosion in demand for health tech related roles. And the reason is very simple. Number one is as a result of digital transformation across the healthcare space. A lot of medical organizations, healthcare organizations today have one application or the other, and they're trying to implement digital systems to become more efficient and gather data more efficiently as well. And the second reason why you'd see roles within health tech exploding across the major economies is as a result of the aging population. And I'll give you an example. The aging population. So there is a higher demand or increased demand for healthcare services simply because of the aging population within that country. And let's take the UK as an example. So the UK as an example, over 12.7 million people are over the age of 65. They are 65 and above. 12.7 million people. And that represents about 19% of the population. And what does this mean? It means that the more people you have that fall within this bracket of 65 and above, the more healthcare services that they would need. So you have more frequent visits to the hospital gathers more data, and because they have more patients, they gather more data, they need more professionals like you who have medical experience, who have healthcare experience, and want to work from the tech aspects within healthcare. So you want to come in to help them analyze this data, improve their processes, help them build more applications to make them more efficient. In the US, for example, or in Canada, about 8 million people within the population are over the age of 65 and above. And this represents about 20% of the population. So one in five Canadians are 65 and above. more visits to the hospital, more data generated, the demand for health tech professionals keep on exploding. And in the US, you have similar, age population and age group. 61 million people in the US are 65 and above. So this is one of the major reason why there's an explosion for health tech professionals and why this is the best time for you to get into the space, for you to move from your current role in healthcare and position yourself for accelerated growth over the next few years. And the government, different organizations are investing heavily in health tech. So it's not just a trend, it's a long-term global shift. And you need to position yourself for that. All right. So some of the high demand career path you want to look at in health tech, you have the healthcare business analyst role, healthcare business analyst, the healthcare informatics specialist. You must have heard some of these roles during your research and so on. The healthcare data and reporting analyst, the medical data analyst, the healthcare data analyst, the clinical data analyst, pathology data analyst, healthcare insurance business analyst, healthcare IT project manager, and healthcare digital transformation officer. These are some of the most popular high demand career path within health tech. Okay, so the big question is, how do you get into any of these roles? What do you need to do? How do you equip yourself with the skills? How do you build the experience so you can transition from bedside into the tech ecosystem within healthcare? Okay, and of course, as you look at these roles, you also look at the amazing number of opportunities. Like I said, high in demand. And I just did a search. Go to the NHS, jobs.nhs.uk, and you do a search for the data analyst within the healthcare space. Over 2,936 jobs are available to apply to. So even if you decided to apply starting today and you want to apply to all these jobs, 10 jobs per day, it will take you the rest of the year to apply to all these jobs. And these are new jobs that are available and so on and so forth. You'd see different roles still within the healthcare data role. You'd see roles like the pharmacy, clinical, informatics, data analyst with a salary of about £56,000 to £63,000 per annum, depending on your experience and depending on what you bring to the table. You have the medical devices analyst. In the US and in Canada, you have roles like the analyst, healthcare, and data. And it's between $70,000 to $112,000. The healthcare data analysts within the data ecosystem, you have $105,000 to $130,000 per annum. And guess what? These are mid-level roles. This is an entry-level role, and that's why you'd see $70,000 per annum. So these are roles that anybody here today, within the next 6 months, can build the skills, learn the skills, work on projects, know how to do the job, and start applying to jobs. People have asked me so many questions. Why do you have so many roles available within the NHS? The NHS in the UK hires the largest number of people within the UK public sector. They are one of the largest employers of talents in the entire country. And we have a lot of alumni from Tenalytics working with the NHS. And I'm going to share the success stories with you, how they were able to get in. Okay. So step by step, you start to understand the roles that are high in demand, the amazing salaries. In the UK, you have a minimum of about £36,000 to £60,000. And this is just the range. 36,000 is pretty average, okay, in terms of the salary you can get per annum, but you are inching towards about £60,000. So this is just to give you a range and an idea of what is possible. We've seen people get jobs, £55,000, close to the £60,000, and we've had somebody got a job of £60,000 transitioning into a healthcare business analysis role. You have in Canada, you have an average of about 66,000 to 106,000 Canadian dollars, and in the US, about 80,000 to 173,000 dollars. Okay. So, and of course, the big question is who are the people getting these jobs? How did they get the jobs? What did they do to get the jobs? And so on and so forth. So, I'll share very quickly some success stories with you. People like you, they joined a session like this for free. They listened to what they needed to do. They started doing those things. And within a very short period of time, they were able to transition. And one of them is Ikmat. Ikmat was a stay-at-home mom. She was out of work for over 2 years. She had a 2-year employment gap. Now, she moved to the UK for a master's in public health, and she wanted to restart her career and secure visa sponsorship. So when she decided to move back to land a job that was within the UK after her master's, she wanted to get a job. She had a 2-year employment gap. But while she was undergoing her master's, she realized something. She didn't want to do bedside. She wanted to do things around public health analysts, business architects within the healthcare sector and so on. And she started to research and search for jobs available. And one thing that stood out to her was the fact that the things she was learning during her master's were not what she saw when she looked at jobs, the jobs available for those roles, the public health analyst, the information analyst, the healthcare data analyst. She saw different sets of skills. So she knew early enough that there was no way her master's was going to give her the type of job that she wanted. So she joined Tenalytics. She joined our healthcare data analytics program, and she was able to land a job with the NHS as an information analyst with the Sussex Community NHS Foundation Trust. And the job came with full visa sponsorship. This was somebody who had a 2-year employment gap, no experience in healthcare, but she landed a job as an information analyst with the NHS in the UK. Then you have Toyin. Toyin was a pharmacist back in Nigeria. She moved to the UK. She wanted to get a job in tech. She wasn't sure what to do. Just like so many people, like I said, a category of people that want to move into health tech, but you don't know where to start from. You have no clue, no idea. Toyin joined the Tenalytics healthcare data analytics program. She learned all the skills she needed to learn. We equipped her with the skills. We worked on her CV for her. She applied to multiple health tech roles consistently. And eventually she was able to land her first job with the NHS as a benefits analyst. And last year, January 2025, she landed the second job with the same NHS trusts as a pharmacy data analyst. How did Toyin do it? What did she need to learn? I'll break that down as we move on. You have Pavel. Pavel is in the US. He got a job in health tech in the US. So Pavel had background in education. He was a teacher back in Cameroon, and then he moved to the US. He joined our healthcare data analytics program. We worked on his CV. He learned all the skills, worked on projects, joined all the mentorship sessions, tailored his CV. He was very specific. He wanted to get a job as a healthcare data analyst. So we showed him where to apply, how to apply. He did all the strong applications, built a very good portfolio. And last year, March 2025, Pavel landed a job as a healthcare data analyst with the Arizona Community Physicians in Tucson, Arizona, in the US. And he got the job less than 3 months after completing his program. This was somebody who was a teacher back in Cameroon. Today, he works with the Arizona Community Physicians as a healthcare data analyst. You have somebody like Ramat. Ramat had a customer service experience, customer service background. She worked with British Gas in the UK as a customer resolution agent, but she didn't want that. She wanted sponsorship, and she knew there was no way her customer service experience was going to give her a job that came with sponsorship. So what did she do? She joined our healthcare business analysis program. We worked with her. We prepared her CV, built a portfolio, prepped her for multiple interviews, and most importantly, she worked on projects that enabled her know how to do the job on day one. And Ramat today also works with the NHS as a business architect, and a job came with full visa sponsorship. Now, for in Ramat's case, Ramat got this job even before she completed the program. So she was still undergoing the program before she completed. And these amazing professionals have recorded videos that you can watch, you can listen to them, hear their transition story, and how they were able to do it from their own lens. So what you want to do is to make sure that you feel the attendance. Don't miss out on that, okay? Feel the attendance. My colleagues will drop that from time to time in the chat. And then you'll get access to all the materials. You can go back, listen to all these amazing professionals, and so on. Now, I'll show you one more success story, and then we'll move on to the skills you need to consider based on the career path that would get you the job the fastest within HealthTech. So this is Sharon. Sharon was a healthcare assistant, also working with the NHS. Remember when I said we have a lot of alumni working in the NHS, and the NHS is also one of the organizations that recruits the highest number of talents in the UK. So Sharon worked as a healthcare assistant with the NHS, but she wanted to move from the role of a healthcare assistant. She wanted to leave Bedside. So what did she do? She joined our healthcare business analysis program. We worked with Sharon. She joined us in March 2025. And I want you to take note of the timeline. And this is where experience in healthcare becomes powerful. Now, because Sharon had experience in healthcare, she knew a lot of the terminologies, a lot of the nuances within healthcare, the patient workflow, and so on and so forth. So she learned very fast when she joined. She joined us in March 2025, the healthcare business analysis program. She learned the skills, she worked on projects, tailored her CV, joined all our mentorship sessions. And today, Sharon works as a business data analyst with the same organization. She kept her sponsorship, but she got this job in May 2025. She joined in March and got the job in May, less than 3 months after joining. And I'll show you the reason how Sharon was able to accelerate her journey. Number one was between 3 months in the healthcare business analysis program, you would have learned some data skills, Excel, Power BI, SQL. You'd have also learned process mapping, how to map processes using tools like draw.io. So she knew how to do that and also knew how to apply the agile methodologies on projects. And that was enough. She hadn't completed the program, but she saw that opening and they required the skills she had at that time. We encouraged her to apply. She applied. We prepped her for the interviews and she landed that job. And that's Sharon's story. Okay. So these are amazing professionals. Ikmat, stay-at-home mom. Today, she's an information analyst. Tony, a pharmacist back in Nigeria. Today, she's a pharmacy data analyst. Sharon, a healthcare assistant. Today, she's a business data analyst, and they're all in healthcare. So what are the skills you need to learn? What career path would get you these type of jobs? Just like Tony, like Sharon, like Ikmat, like Ramat, who was a customer service professional, but today is a business architect with a healthcare organization, the NHS. So I'll show you the skills you need to learn as a health tech professionals, and more importantly, how to learn the right way. Because I made these mistakes myself. When I was transitioning, I learned the wrong way and it's wasted so much time. I wasted so much time. I struggled on very simple issues because I wanted to figure it out myself. Okay. So you don't make those mistakes. So what's the best way to learn so that when you get that job on day one, you know exactly what to do. All right. And the fantastic part about all these professionals I shared, None of them had prior tech experience. They were all newbies. They were all new into tech, but they were able to learn the skills, apply those skills, gained experience using those skills, and that was what enabled them land those jobs. So we're going to look at the first career path. And this is where I want you to pay very close attention. Are we able to aim for and get any remote job? All the people I've shown you so far, Ikmat, for example, she works 100% remote. She works with the NHS as an information analyst, but she doesn't go to the office. Ikmat is one of the coaches in the program. So what we do is for people that have gotten these jobs, alumni, we bring them back. So you get to hear from them. They get to hold your hands. Before you get a job with the NHS, for example, you'd write a supporting statement. Okay. So what type of supporting statements gave Ramat this job? What should you look out for? And so on and so forth. Okay. So all these jobs are remote opportunities. As an information analyst, you don't need to step into the office to do your job. And I'd explain exactly what professionals like this do and what you do when you get a job like this. Okay. So let's start with the healthcare project manager. Healthcare project manager. This is an amazing career path in health tech. You are a project manager, but not in other industries. You are focused within healthcare. And this is because healthcare organizations, hospitals, medical insurance organizations always have one project or the other that they have to deploy. And they need somebody to manage those projects. Okay. So a healthcare project manager is somebody who plans, organizes, and makes sure healthcare projects are completed successfully. They're completed on time, within budget, and the projects work properly for both the staff and the patients. And I'll give you an example. Okay, so I'll take it out of healthcare, use a general example, and then I'll bring it back to healthcare. So let's imagine you want to build a house. Okay, you want to build a house. I hope you like the drawing of the house. Okay, so you want to build a house. You are the person that wants to build a house. So you have the money, you have the cash, but you don't know how to build. You'd need to get a builder, you'd need to get plumbers, electricians, designers, and so on and so forth. But do you manage them yourself? No. Who gets all these people and manage them? You have a construction manager. Okay, a construction manager. So just imagine you have a construction manager who would manage the plumbers, the electricians, the designers, the builders. They would ensure that they coordinate everything and nothing is delayed. The construction manager would ensure that the electrician does what they're meant to do. The plumbers do what they're meant to do, and so on and so forth. Ensure that everybody works and everything is done in the right order. And more importantly, that house is completed properly to the design of the owner. So when you have a question or you want to change something, maybe instead of having 2 windows, you want to have an extra window somewhere, you don't speak to the builder yourself. You'd speak to the construction manager because they coordinate everything. Okay, so just substitute this into the healthcare space. The project manager is the person within that healthcare organization that coordinates everybody working on a project. All right. So when the hospital leadership wants something done, they want to build a new application, they want to implement a new electronic health record system, and so on and so forth. They don't do it themselves and coordinate people themselves. There's a project manager responsible for coordinating, ensuring that it is done within budget, within the timeline, and also within the scope of what the leadership wants. All right. So that's similar to what the healthcare project manager does. So let's imagine the hospital wants to implement a new electronic health record system, because currently they have a manual process. So when patients come into the hospital, they have to fill manual forms and the records are all messy and so on and so forth, simply because they don't have an electronic health record system. They want to implement one. What do? The project manager takes up that project. They would involve the doctors, the nurses, the IT team, that's the technology team that would implement and build that electronic health record system. Okay, they involve the software vendors, the hospital administrators, and so on. And what they want to ensure is transfer all the patient records that are manual into a digital system without impacting or disrupting patient care. Okay, so the project manager would ensure that they define the timeline. How long is this likely going to take us to complete? Who are the stakeholders that will be involved in this project? And how do I coordinate and manage and ensure that we get this project delivered within the budget? So let's say the hospital has £1 million or $2.5 million for this project. How do I manage the budget to ensure that we don't overspend and we work within the budget? And of course, how do I ensure that I monitor the risk, resolve issues as they come up, anticipate risk of transferring patient records that are very sensitive? Okay, so that's the role of the project manager. So as a healthcare project manager, you are somebody who would interact with people. So you can't be an introvert and be a healthcare project manager. You have to be an extrovert. You'd manage people. You would interact with people. You would ask questions, interview people across departments, across units, and so on and so forth. Okay, and when that project is completed and deployed, you would ensure that employees within the organization know how to use that particular system. And at the end of the day, the overall goal for you as a healthcare project manager is to ensure that system is successfully delivered to the hospital, meeting all the requirements that was set at the beginning of the project. Okay, so it's launched within schedule. Employees, the staff that needs to know how to use that application, knows how to use the application. The patient data was securely and successfully transferred from a manual process into a digital electronic healthcare records. And of course, operations continued smoothly during the transition period. So that's your role as a healthcare project manager. You ensure everything is done seamlessly, on time, on budget, and within scope. So like I said, you can't be an introvert and be a healthcare. You'd get to work with people across multiple departments. You'd follow up for updates. You'd have meetings, updates on project meetings. If there is anything that needs to change, you'd have a meeting with the leadership, the project owners, and so on and so forth. That's the role of the healthcare project manager. Okay, and as a healthcare project manager, you will need to have domain knowledge in healthcare. Okay, so if you have experience, you've worked in any capacity in healthcare as a nurse, as a care worker, support worker, healthcare assistant, physician associate, physician assistant, and so on, you would have the domain knowledge. But what you need to add to that, you need to have project management skills. Now, if you don't have the domain knowledge, you can learn and understand the domain knowledge. It's part of the things you would learn during your learning journey. But if you have that knowledge already, all you need to do is learn and understand the key metrics, the terminologies you need to be familiar with in that career path. And you add project management skills to it. And this is a career path that employers are actively hiring for every single day. You can work remotely. You can have your project briefs, your project updates, your project meetings with your different team members virtually online, just like the way we are having a conversation today. You set up your meetings, your project updates, your stand-ups, and so on and so forth, your sprint retrospectives, and so on and so forth. You can do this remotely and so on. Okay. This does not require, so if you're somebody who doesn't want to do anything technical, you don't work with too many technical tools. Your tools are pretty straightforward. You work with tools that help you manage the project, see when you have a deadline coming close, where are the dependencies of the different things you need to work on. So your tools are not technical. You're somebody who doesn't want to work with technical tools. You want to go clearly away from bedside care. This takes you clearly away, completely away from bedside. Okay. So apart from the domain knowledge, what are the technical skills you need to pick up? You need to learn tools like Confluence. Confluence would help you collaborate with other team members on projects. You need to learn Jira. Jira helps you track your project deliverables. So we need to have in the electronic health record system, we need to have part A and part B delivered within the next 1 week. You can track those deliverables using Jira as a tool. You can track your team members' responsibilities using Trello. So, Ade is working on this. Michael is working on that. Josephine is working on this. You can track your team members' activities, their tasks, and their responsibilities using Trello, because that's your responsibility as a project manager, ensuring that everybody does what they're meant to do and you deliver that project on time, on schedule, and within budget. You'd learn generative AI using ChatGPT, and you'd also get to learn Draw.io for process mapping. All right. So you'd learn different other skills, introduction to project management methodologies. You'd learn and focus a lot on the Agile and the Scrum framework, the Agile methodology, the Scrum framework, advanced Scrum and Agile practices. You'd learn how to use Jira and Confluence in project practically, and so on and so forth. So these are the skills you need to learn. And like I mentioned, if you've never seen or heard about any of the things I've said before, you are in the right place, because the curriculum takes you from a beginner. We assume you know zero, you know nothing, and you learn all these skills, you work on all these projects, you build the skills you need to build, and you can now start applying to jobs. But learning the technical skill is not enough. Remember, you need to have experience. And apart from experience, you need to know how to get the job. So I'm going to walk you through how to do that. But as a project manager, for somebody who wants to go completely away from bedside care, you don't want to work on anything technical, you're in the right career path. If this sounds like what you want to do, if this sounds like you, type PM in the chat. If this sounds like you're somebody who doesn't want to do anything technical, you know that you're going to manage people, manage stakeholders, and manage people from different departments, different units, ensure projects are delivered on time, on schedule, and within budget. Fantastic. Jojo says PM. Al-Wazir, Adejoke, Myra, Doing, absolutely fantastic. Anifat, Saeed, Lucy, Bumi, Doctor, absolutely phenomenal. Olushola, a lot of people want to get into healthcare project management. And of course, the average salary for those in the UK is about 57,000 to 80,000 pounds per annum. In Canada, about 87,000 to $116,000. And in the US, 96 to about $107 per annum. And that's an average. Okay. So it's not in any way fixed. Is the average salary per annum that you'd see what the possibilities could look like landing a job within this space. Now, for some of you, you are introverts. You really don't want to be out there managing people, holding stand-up meetings, giving project updates, following up with people on the tasks and responsibilities that they have. You want to work more from the background. You want to get data, analyze the data, and present your findings. This is what I analyzed, and this is what I found. That's the only time you get to present. You get to showcase and have presentations. You want to work more from the background. Okay. That's where the healthcare data analyst role comes in. Now I can see Said, you have your hand up. Said, I'm going to come to drop your question in the chat. I'll pop in there to take questions from time to time. Okay. And we'll have a Q&A before we wrap up. So make a note of that question so you don't forget. Now, let's talk about the healthcare data analyst. And I want to explain what they do using a simple case study. All right. So a mid-sized hospital is currently facing ICU congestions. They have bed shortages and the inpatient cost keeps on rising. So the leadership wants to know, they want to improve the patient flow. They want to improve cost efficiency and of course, the quality of care of all the patients. So they want to know the length of stay, how it varies by medical condition. So what this simply means is when a patient comes to the hospital, how long do they stay based on their medical condition? So does somebody with a headache stay longer than somebody with arthritis? Does somebody with cancer stay longer than somebody with, a neurological problem or something, around that? The leadership wants to know. The leadership also wants to know what department has the longest length of stay. So patients in neurology or patients in oncology, do they stay longer than patients in orthopedics, for example? And they also want to know the bed type. How long does a patient stay based on the bed type? So if they know the answers to these questions, that would help them improve, bed utilization, help them improve the cost efficiency of running that hospital and improve the quality of care. So they want 3 questions answered. Question number 1 is, which medical condition has the longest length of stay? Question 2, which department has the longest length of stay? And question 3, what type of beds have the longest length of stay? These are the 3 questions. But who answers these questions? Okay, who would answer these questions? The healthcare data analyst. So to answer this question, you don't need to have experience with bedside care. No, you can do this from the comfort of your home. All you need is to have access to the data. And that's where the healthcare data analyst would gain access to the data. So let me pick somebody in the group, for example. Let's say Abayomi. Abayomi here on the call is a healthcare data analyst. So what would Abayomi do? Abayomi will gain access to the healthcare records in the database in that hospital, the electronic healthcare records or the EMR, the electronic medical records. They get access to that and they come up with a spreadsheet like this. And this spreadsheet shows the visit ID. It shows the patient ID. So each patient is tagged or recognized by an ID, just like your staff ID and so on. Okay. Your admission dates. When did this patient get admitted in the hospital? 25th of March, 2022. When were they discharged? Discharge date, 31st of March, 2022, which means the length of stay, they stayed for 6 days. What was their medical condition? Cancer. What department? Oncology. The doctor ID, that's the doctor that, treated them and was responsible for their care. And what hospital bed did they use? Semi-private room. Now, this is what the data looks like. But if I send this to leadership would struggle to understand when of course we have maybe 1,000 or 5,000 patients. So how can I answer the question of which medical condition had the longest length of stay? I have to go through the records one after the other to see which medical condition had the longest length of stay. Nobody would easily understand, not the leadership, who they don't care about what this is all about. They want to simply see the results. Give me the answers to these questions. So do you know what Abayomi will do as the healthcare data analyst? He would use tools and technologies like Excel, Power BI, Tableau, to analyze this data. So even if you have 1 million records of patients, it doesn't get more complex. All you have to do is understand how to use Excel, understand how to use Power BI, understand how to use Tableau, and these tools would answer these questions for you. You carry out your analysis and you present your findings. So our Biomi will take this data. And that's what we do. We teach you how to use these tools, and anybody here can use any of the tools I've mentioned to analyze the data. So they take this data, Biomi will take the data, feed it into his analytic tool like Power BI or Tableau, and generate a report like this. So this report answers those 3 questions. The first question is, which medical condition has the longest length of stay? When you look at the first chart at the top left corner, you would see a Biomi has highlighted tumor and cancer as the medical conditions with the longest length of stay. So within 1 second, anybody can see this. And that question has been answered. But looking at the data, the way it was scattered right here, it's difficult for anybody to make sense of this. But the healthcare data analyst will take this data, transform it into a report like this, and show the medical condition with the longest length of stay. Question number 1 answered. Question number 2, which department has the longest length of stay? Again, that is the oncology department. Very easy to understand and easy to see. Why? Because the data has been analyzed and transformed into a dashboard that anybody, either you have technical skills or you have no skills at all whatsoever, you can interpret what you are looking at. And I want everyone on the call to answer question number 3. So question number 3, looking at this chart right here, what type of bed have the longest length of stay based on what you can see in the chart? Just type it into the chart. Type into the chart. Private room, absolutely. Thanks, Oluwaseyi. Karina, private room. Omolade, Mary, private room. Akindele, let me see. Esther, absolutely. Private room. So it's very easy to understand. If I had asked you the same questions looking at the messy data, it would have been difficult for you to give me a straightforward answer. Okay, so we can see that the private room has the longest length of stay. So looking at this, the leadership can take a decision. And as a healthcare data analyst, your role doesn't stop from just creating charts. What do? You have a summary and you also have a recommendation. What do you think should be done based on the data you have analyzed? So you're writing to say the hospital could explore optimizing the oncology department's processes to reduce the length of stay, potentially freeing up resources for other patients. So you give your recommendations on what you think should be done based on the data you have analyzed. This is the role of the healthcare data analyst. You take data that looks messy, confusing, people can't answer any question using this data, and you transform it into a report that anybody can see and understand and can take decisions based on the analysis you have carried out. All right. And how do you generate this? You sit at the comfort of your home, you gain access to the data, you use tools like Excel, Power BI. This was generated using Microsoft Excel, for example. Okay, so you learn how to do the same. You learn how to use the tool to analyze the data to generate a report like this. And anybody here, like I mentioned, can do exactly what I've shown you. Okay, so a healthcare data analyst, you focus on analyzing healthcare data, clinical data, medical records to help the hospital make better medical decisions, reduce costs, and improve operational efficiency and patient outcomes. That's your focus. And you can work in different organizations, not just the hospital. You can also work apart from hospitals, you can work in a government health agency. You can work in health tech companies, pharmaceutical companies. healthcare insurance companies, and so on and so forth. That's the beauty of the healthcare data analyst. Now, the healthcare data analyst is somebody who you don't make, you don't have too many meetings, you don't manage people. Your focus is on getting the data, analyzing the data, speaking to stakeholders that use that data, understanding what they want to see, what questions do they want answered. You take that data, go back, use your tools and technologies and help them analyze and answer those questions. So you're making presentations on your findings to show this department has the longest length of stay, this particular medical, you know, conditions have the longest length of stay, and so on and so forth. You are carrying out analysis like that. So if you see yourself as somebody who is a healthcare data analyst, type in HDA into the chat. HDA. Zainab, HDA, Karina. Karina wants to do everything, but Karina, that's absolutely fantastic. It's fine. You can have more than one that you're interested in. Everybody, HDA, HDA, HDA. A lot of people don't want to, take up the burden of having to manage people, having to interact with stakeholders, both internally and externally. This is a perfect career path for you. Okay. So here, and this is the type of job ICMAT got. So when somebody asked the other time, can I work remotely? Remember ICMAT. That's what she does. Her role is to sit at the comfort of her home, analyze data for the NHS, give her presentations, make a report, and send to the necessary stakeholders for them to take that and use to make decisions. When you ask ICMAT, for those of you that will join, ask her this question. ICMAT, what do you use data to do for the NHS? She'll tell you that I use data for good, to do good things. Okay. Data for good. That's one of ICMAT's mantra. Okay. So, and of course, a healthcare data analyst, your focus is to use data for good, to use data to help the hospital make data-driven decisions, better decisions, improve their processes, improve operational efficiency, and so on and so forth. All right. So a lot of people want to do healthcare data analytics. That's absolutely phenomenal. All right. Lawrence as well. So now let's look at the third career path. Now, the third career path is an interesting one. Okay. But before we do that, I'll show you the skills you need to learn to become a healthcare data analyst. All right. So, of course, domain knowledge is very important. You need to have the domain knowledge. It becomes a lot easier for you to recommend when you're looking at the data and analyzing. You have insights because you have knowledge about that sector. So, if you have experience, like I said, you've done 50% of the job. So if you're on the call today, you are a nurse, a medical assistant, a healthcare assistant, physician assistant, physician associate, care worker, support worker, and so on. You have 50% done. Then you also have to learn the data analytics skills. Again, if you don't have the domain knowledge, you're not in any way deficient because you would learn the domain knowledge during your training. Okay. And for the healthcare data analyst, you're looking at income of about 52,000 to 61,000 pounds per annum. For those of you, joining in from the UK, for those from Canada, about 103,000 Canadian to $121,000. And for those in the US, about $110,000 to $168,000. So apart from the domain knowledge, what specific data analytics skills do you need to learn? You need to start from problem solving. You learn Microsoft Excel, the same tool that was used to generate that dashboard that I showed you. Okay. SQL, structured query language, Microsoft Power BI, Tableau. These are the tools and technologies you would learn to use to analyze the data the hospital would generate. And remember, we take you as somebody starting from kindergarten because we assume that you don't have any knowledge. You've never done this before. And you learn and the building blocks to what you need to know step by step. You learn that. And by the time you are done, you have everything you need to do the job. You'd learn data storytelling because you need to tell a story from the analysis you've come up with. Your chief medical director, the hospital leadership have no idea what Power BI Tableau is. You know that because you've learned how to use it. So how do you tell a story from the analysis you've generated? Okay. And that's a skill you'd also get to learn. And this is where presentation becomes important. You'd learn generative AI for data analytics using ChatGPT and Microsoft Fabric. So these are the skills you need to learn to become a healthcare data analyst. And the third health tech program we'll look at today is the healthcare business analyst. Now, the business analyst is sort of in between the project manager and the data analyst. Because as a business analyst, you'd have some data analytics skills, not everything, but you learn data skills. You'd also learn project management skills. So the business analyst focuses on one specific area of the organization. Every organization in the world have three major components: people, processes, and technology. Every organization. So the business analysts would focus on what? Processes. So your focus as a business analyst is, how do I make this process more efficient? If something takes time, takes 5 days, how do I reduce it to take just 5 minutes? That's your focus as a business analyst. So a business analyst is someone who helps an organization identify problems. There's a problem, this thing takes too long. You improve the process by implementing solutions like automation and so on and so forth. All right. And I'll give you an example very quickly so you have a better understanding. So let's take that same hospital that doesn't have a proper patient management system. Okay. A patient management system. So when patients want to book appointments with a physician, with a doctor, they have to place a phone call. So they place a phone call and a lot of people walk into the hospital. So you have too many walk-ins compared to people that have booked appointments. And because of that, you have congestions, too many congestions in the hospital all the time because people can't book online. They have to call to book or they have to walk in to get care. All right. So what does the business analyst do? The business analyst would speak to the different stakeholders, the doctors, the nurses, the healthcare administrators, the front desk officer, speak to everyone to understand the problem the way it is. And what do they do afterwards? They would map out the current process. So how does this process start and how does it end? When they understand the process, they can look for inefficiencies. So the process starts here and it ends here. But there are gaps within this process, and there are inefficiencies within the process. And that's why people cannot, easily book online and they have to come to the hospital to walk in. And because of that, we have so many congestions. So do you know what the business analyst would do? The business analyst would say, let us introduce an application. Let's introduce a software. Let's introduce something that would enable patients at the comfort of their home to book their appointment online. And that thing is called the patient management system. Now, the business analysts would not build the patient management system themselves. They would recommend based on the problem they've seen and based on the analysis they've carried out and based on the conversations they've had with the doctors, with the hospital administrators, and so on and so forth. Now, when they introduce that we need to build this patient management system, they would also have another interaction with all the different stakeholders in the hospital, the patients, the doctors, the nurses, hospital administrators, everybody, to understand this patient management system, what should it have? Okay, somebody says number one, it must have ability for people to book appointments online. Number two, somebody else would say, okay, we need this application to send automated reminders. Automated reminders. So the business analyst would gather all the requirements that this application needs to have. Number one, number two, number three, as many as possible. They create a document that contains all those requirements and they transfer that to the IT team or the technology team. So the business analyst is a middleman between what the hospital wants and the IT team that would build that application. If you're following me, type a 1 into the chat. Just type a 1 into the chat if you're following. Okay? Fantastic. 1. Brilliant. So the business analyst has recommended we need to do this. They sit with all the stakeholders, understand, okay, it needs to have abilities for people to book online, send automated reminders, and so on and so forth. You can have as many requirements as possible. They then transfer that to the IT team, the technology team that would build that application. So the business analyst would work with them during the software development phase as they're building the software to ensure that all these requirements from number one, number two, to as many requirements as possible, those requirements are implemented. The business analyst would test with the team, ensure it's working well. And when it is deployed or before it is deployed, the business analyst would organize training sessions, communications would go out to all employees and all the patients of that hospital. So they know that we now have a new patient management system so that rather than walking in and creating congestion in the hospital from the comfort of your home, you can now book appointments online. The business analyst is responsible for that. Okay, so the business analyst role is centered around talking to stakeholders. You would run a lot of meetings because you need to understand all these requirements before you communicate to the IT team that will build the application. You would document the requirements. Okay, you would support the project delivery, and you'd also help the team implement the solution when it's ready. So appointments that used to be a hassle, congestions in the hospital will disappear because you have implemented the patient management system. That's the role of the business analyst. You serve as a middleman, intersection between helping the business improve their processes and become more efficient and the technology team that would build those applications for the business. Okay, so you'd learn some amazing skills as a business analyst. All right. Again, you need domain knowledge. That's a given. You need to have knowledge about the sector. Give me 1 second. Knowledge about the sector, the healthcare sector. If you don't have experience, again, you would learn all of that. If you have experience, then you are in very good hands. You don't have any issues. You have 50%, and all you need to gain is the business analyst skills. Okay, so the business analyst earns tremendous salary. Okay, in the UK, you're looking at something around £52,000 to £65,000 per annum. In Canada, about $95,000 to $120,000, and in the US, about $93,000 to $140,000 US dollars. High paying, absolutely phenomenal salaries, and of course, you'd learn different tools and technologies that borders around, like I mentioned, you'd learn some data skills. So you're going to learn, sorry, I'm just going to move back 1 step. Okay, so you'd learn how to use Excel, Power BI, and SQL. These are your data skills. Then you'd learn project initiation and planning, Agile and Scrum for projects, software development lifecycle. These are project management skills. So you'd learn some data skills, you'd learn some project management skills, and then you'd learn your core business analysis skills, process mapping, requirement fundamentals, elicitation, stakeholder analysis and engagement, generative AI for business analysis using Chat GPT. So you'd learn tools like Draw.io, Lucidchart for process mapping. You'd learn Trello, Jira, Azure DevOps for managing projects. You'd learn Excel, Power BI, and SQL. These are your data skills. So as a business analyst, you'd learn these critical skills to enable you perform your role as a business analyst. And just like the other programs, you don't need prior experience. Now, if this sounds like something that sounds exciting to you, something you think you can do, type in a 1 into the chat. Okay, just type in a 1 into the chat. Okay, 1, fantastic. Sunny, Chidera, okay, Shifao, brilliant. So we have people who want to do different career paths. The healthcare project management, the healthcare data analyst, and the healthcare business analyst. Fantastic. Bello and Fanny also wants to do the healthcare business analysis. Now that you know the skills you need to learn, the next big question is, what's the best way to learn? Because Adeza, you said a lot of people make mistakes in the way that they learn. Absolutely. So one of the things you also want to do is learn the right way. When you learn the right way, you know exactly what to do on day one when you get the job. And the best way to learn and what we focus on for us at Analytics is number one, you learn in a project-based environment. And what does this mean? It means you learn by doing the job. So for those of you in healthcare project management, you would work on healthcare projects. You'd manage healthcare related projects. You'd learn by doing the work as a healthcare project manager. For those of you in healthcare data analytics, you'd work on solving and analyzing data that are healthcare related. You would do the job of a healthcare data analyst so that on day one, when you get that job or when you get into the room during an interview, you know exactly how to answer questions. Why? Because you've done it before. That's the only way to learn. You don't learn by watching videos on YouTube and so on and so forth. That's not how to learn to become a healthcare data analyst. And that's the problem a lot of people face. They try to do these things. I did it myself when I was trying to transition about 13 years ago. But guess what? I got frustrated. I couldn't solve very simple problems because there was nobody to tell me that this is what the job requires and this is what you need to do. So number one is you must learn by doing the work. So you're going to work on projects depending on the program you've joined. You work on projects within that space, healthcare related projects, NHS data, Alberta Health Services data, medical data from the US, and so on. So these data sets have been codified. So you cannot tie any part of the data to a patient or to a hospital. The data has been codified for data privacy. But you get to work on these type of data sets. Just something like this, like I showed you earlier, where you have the data around, answering 3 questions on the length of stay. So you work on these type of projects, so you know exactly what to do when you get the job. Once you've done that, what's the second thing you need to do when learning? Showcase your work. So for so many people, nobody knows who they are. Nobody knows how good they are. Nobody knows the type of projects they've completed. No idea. You must have a portfolio that showcases the work you've done. This is what shows that you have experience. All right. So project-based learning is learning by doing the real work. When you've done that work and you've worked on projects, you must have somewhere to warehouse the project as evidence that you've done that job before. Recruiters want to see that you have done it, not you telling them that you can do it. Nobody cares about what you can do. They want to see what you have done, and that gives them the confidence that you're the right person for the job. So you're going to work on numerous projects, cutting across different healthcare organizations. St. Luke's Hospital, where you'd work on a data analytics project to help them improve operational efficiency, optimize patient care. You'd work with Medex Pharmacy. It's a pharmaceutical related project. You'd work and build a dashboard for an emergency room, Green Hill Medical Center, and so on and so forth. Numerous projects, a minimum of 10 projects before you wrap up your program. All right. Now, when you work on all these projects, remember, I said you must have a portfolio. And a lot of you are wondering, what does a portfolio look like? So I'm going to show you what a portfolio looks like very quickly. So a portfolio is where you warehouse all the projects you've completed. So this is Victoria, for example. She worked on a project for Deep Care Hospital ER visit analysis. So she helped this hospital optimize their emergency room. And this helped to reduce patient wait time by 15%. So she didn't just work on this project. What did she do after working on the project? She warehoused it in her portfolio. So the link to this portfolio would be on her CV and also on her LinkedIn. So anybody can see the quality of the work she's done. And I can come here and I can click on this link to see what she's built. And I can see the dashboard. It's available. Anybody can see it. A recruitment consultant, a hiring manager, a talent sourcing specialist, they can see exactly what you've done. And they know they are the right person for the job. So this is an emergency room dashboard. If you click on this, it deselects everything. You want to see data for only Q1, click on Q1 and the reports for Q1 appears. This was built using Tableau by Victoria, who had no experience, no knowledge, but she learned how to use Tableau. She fed in the medical data into Tableau and built this report. You would also learn how to do the same. So your portfolio would also have other projects within it, not just one project. So multiple projects using multiple tools and multiple technologies. So number 3, we are going to number 5. Okay. So we are almost there. Now that you know that the first thing you need to do is identify the right career path. We've looked at 3, and some of you have identified the career path you'd like to take. Healthcare data analyst, healthcare project manager, healthcare business analyst. You know, number 2 is you know that you can't just learn anyhow and anywhere. You have to learn in a project-based environment, working on projects, solving real-world problems, the type of problems you'd face when you get that job. And you do that in a project-based environment. That's how you learn. And when you learn, you build a portfolio. I just showed you what a portfolio looks like as evidence that you've done the job before. Number 3 is you must gain experience to showcase to employers that are the best candidates for the job. You must know the different regulations within healthcare. You can speak about the different KPIs within the healthcare space. Okay, for those in the US, you can talk about HIPAA. You know what HIPAA is all about, the Healthcare Insurance Portability and Accountability Act. You know, for those in Canada, you have FIPA, which is the Personal Health Information Protection Act. And you have the GDPR for those in the UK. So how do you have these regulations within the healthcare space? How can you talk about things like this during interviews? You would learn about them. You would understand them. You would know that in a medical organization, in a healthcare organization, they want to know specific type of things. They want to look at key metrics. If I'm a healthcare data analyst, I want to talk about bed occupancy rates, mortality rates, readmission rates, length of stay, just like the one we saw, and so on and so forth. This convinces any interviewer that you know what you're saying and you have the experience to do the job. So how do you gain that experience? You gain the experience through the projects you complete in class, project-based learning. I explained that already. So you work on at least 10 projects You take those projects, you put them into your portfolio as evidence that you've done that job. Then you also have 2-month internship with our partner company. We partnered with Amdari. Amdari is also based in London, in the UK, and in Alberta, in Canada. And if you're in the US, you'd indicates that you worked on projects with these companies. With Amdari, for example, we are also a consulting company, so we consult for other companies. So what that does for you is you worked on projects with Amdari when Amdari consulted for other companies, and you got to solve these problems and so on and so forth. So you don't position yourself as a beginner or a learner. You position yourself as somebody who has done that job and has experience doing the job. And that's what your 2-month internship gives to you. So this time around, you are not solving problems alone. You are collaborating with other professionals, solving a common problem. So a healthcare data analyst would work with a data engineer and a cybersecurity professional. The cybersecurity professional's responsibility is to ensure the data is protected from both internal and external threats. The data engineer would build the data infrastructure and the data pipelines. And the healthcare data analyst would get the data from the data infrastructure and analyze the data. Because when you get that job, you don't work in silos. You work with other professionals to solve a common goal. So you learn communication skills, interpersonal skills, team working skills, and you learn how to keep to deadlines and also manage deliverables. These are some of the skills employers want to see from you. And that's why the internship is absolutely important for anyone. All right. And finally, when you've done all these things, you've worked in a project-based environment, you've joined the internship. What next? You must have evidence that you've done them. And that's where your portfolio becomes important. Okay. So number 4 is so crucial. And number 4 is your referencing. So for so many people, especially those of you that don't have jobs today, or you want to move away from your current organization to a new organization, that new organization would always want to validate your background. They want to be sure you are who you say you are. They want to be sure you can do the things you say you can do, or you have done the things you say you have done. And that's where referencing comes up. So when I said we have alumni working in the NHS, this is also one of them. Zule joined the healthcare business analysis program, and Zule was able to land a job last year, March 2025, as a project support officer with the NHS. And the reason why Zule was able to get this job, remember when I said the business analyst learns some data skills and they also learn some project management skills. So while we were preparing Zule for her interview, we focused on her project management skills in business analysis. And that's how she landed this job as a project officer with the NHS. And like I said, the NHS would always validate and always want to request for a reference to be sure that you can use the tools and technologies you say you can use. So they reach out to us, Adeza Suleiman, dear Mr. Adeza, the above named candidates has given us the permission to approach you for a reference. So the NHS would want you to either fill out a form which has been attached to the email or click on this link to fill the reference for Zule. Tell us her strength, her weaknesses, and so on and so forth. You also have Ahmed. Ahmed joined our healthcare data analytics program, and he landed a job in June last year, 2025, as a health informatics support worker. Health informatics. So many people have been asking, oh, if I do healthcare data analytics, can I get a job in healthcare informatics? Absolutely. That's exactly what Ahmed did, and he landed his job. Okay, again, the NHS would always reach out for referencing. You have Mary. Mary got a job as a junior IT desk analyst. She joined our healthcare data analytics program as well. You have Ade. Ade got a job as a senior project manager, also with the NHS. Again, Ade joined our healthcare project management program and he landed this job. And the NHS would always request for a reference. Like I said, Ade got his job in October last year. You have so many other, references. This gentleman got a job, Mawutin got a job as a pathology data analyst. And you have this gentleman who got a job this year as an information analyst. This came in January 2026 this year. Okay, so all in all, we have about 237 alumni working with the NHS. And what does this mean? We know exactly what it takes to learn the skills to land a job in a healthcare organization as a healthcare data analyst, a healthcare business analyst, a healthcare project manager. We know the type of interviews. We know what your supporting statement needs to look like. We know exactly what you need to say during interviews and the skills you need to have to ensure that you know how to do that job when you get the job. 237 and counting. So you should also be the next person to land a job in health tech, especially in 2026. So what steps should you take from now to get there? All right. So I've showed you the different skills. I've shown you the different skills you need to learn: data analytics, business analysis, project management, and then you must package yourself. And what does packaging mean? Packaging means Tenalytics presenting and positioning you as the best candidate for the job. So apart from learning all the skills you would learn, you'd also do what? Gain experience. I've talked about that. Would work on your CV for you. You send in your CV, we update, optimize, tailor your CV to the industry standard for that career path you're trying to get into. So you can beat the ATS system, get an interview. And when you get an interview, we help you prepare for that interview. And I'll show you what your platform looks like very quickly. All right. So you have a dashboard, the LMS, the learning management system that you log into when you register. You can go to your dashboard. If you have an interview, what do? Go to interview preparation. Let me maximize this a little bit. Interview preparation. All you have to do is click on schedule interview session. Fill all the details. What stage of the interview are you currently in? HR, first round interview, select that. What dates do you want to be prepared for your interview? It doesn't matter. You want to be prepared on a Sunday. If I select 20th, which means my interview is on Monday, the 20th, I get prepped for that interview on 19th, this Sunday, the 19th, so that I get prepped before that interview. I fill all the details and I upload the CV that I've used to apply to that job. And somebody will join a call one-on-one and prep me for that interview. So this is positioning and presenting yourself, packaging yourself for the job. We show you how to optimize your LinkedIn profile so that what you have on your CV matches what you have on your LinkedIn. And what we see happen most often than not is the moment you do your LinkedIn optimization, recruiters start to reach out to you. And there are numerous candidates that got jobs without even applying. They were headhunted on LinkedIn and they got opportunities. You build a portfolio, you join our mentorship sessions, which happens every Thursday evenings. And I'll talk about that in a few seconds. You've seen what a job reference looks like. Every organization would ask for a job reference when you get that job. They want a reputable organization to vouch that you are who you say you are. You're not a criminal. You've done this job before with us and you can do the job for them. And we have on-the-job support, which means when you get that job and you find a project, especially at the beginning, that is a little bit more, difficult than you anticipated. What do? We work with you on that project to ensure that you are able to keep that job. So the type of questions you need to ask, how to approach it. We also take note of, data privacy issues and so on and so on. All right. And of course, the final part is apply. So we show you where and how to apply, how to tailor your CV to job applications. And we have paid job boards that you can't find anywhere else except you pay for those job boards. So we as an organization, we make those payments. So we get those jobs and we share them with you for you to apply. And that's why you'd see so many of our participants landing jobs every single time because they're applying to jobs that is not generally available to the public. So you would have gotten your interviews, you get prepped for those interviews, and that's where the opportunities start to come. And that's where you land the job. All right. So what does the training structure look like properly? How long does it take? I can see questions coming in. Oh, Adeza, how long does it take for me to do this? 6 months learning. So you learn with us at Analytics for 6 months, and your internship with Amdari is for 2 months. So it's automatic. It happens automatically. You don't need to do anything. The moment you are done with 6 months, you've completed your projects because there's a dependency for you to do your internship, which means there are projects you should have completed. Once you've completed your projects during your learning, you move into the 2 months internship. Now, for those of you in the UK, you have a class suited to your time zone, 11 a.m. to 2 p.m. UK time on Saturdays. Your live class is not every day. We don't expect you to come to class every day because we know that you are busy professionals. Okay, so you have your live classes. In fact, you don't have every Saturday is not for a live class. So this Saturday, you have a live class. The next Saturday, you have something we call a drop-in session where we look at the things you've done during the week when you watch your videos on the LMS. And it's sort of a rehearsal, catching up on things you did not understand, and so on and so forth. And then the next Saturday, you have another live class. So the live classes are important and are fixed. You have to attend those live classes. The drop-in session, on the other hand, are not fixed because if you don't attend, it means everything is good. You don't have questions, you are good, and so on. But your live classes, Saturday, 11 a.m. to 2 p.m. For those of you in the UK, Europe, similar time zones. And you can also join an evening class, 6 p.m. to 9 p.m. So if you're not available in the morning, for example, in the UK, you can join a class in the evening for those in the US. All right. So the evening class is designed and tailored for those in the US, in Canada, because that's roughly 10 a.m. to 1 p.m. Mountain Time. So if you're in the UK, you have the flexibility of either joining in the morning or joining in the evening, depending on your schedule. So what do you do after your class on Saturday? Any other day at your convenience, anywhere, any day, anytime, you log into the LMS, the learning management system, and you get to practice, watch your videos at your own convenience. And while you are watching your videos during the day of the week, from Monday to Friday, you can book something we call a drop-in session. Okay, a drop-in session is, let's take, for example, let me pick somebody in the group. So let's take, for example, Abayomi. So Abayomi, I'm calling you again. Okay. So let's say Abayomi has registered. All right. And Abayomi is going through his, videos during the week on a Tuesday or on a Monday. And there is something about me. He has a question. He wants to ask. He needs somebody to sit down with him, look at what he's doing, if he's doing it right or wrong. There's something we call a drop-in session. All you have to do is go to your classroom, click on book a drop-in session, click on the Calendly, and you can book a session during the week. So Monday, Tuesday, Wednesday, Thursday, Friday. I can book a session in the morning, in the afternoon, in the evening, and I jump into a session with somebody who would look at what I'm doing, advise me on what I'm doing wrong, and guide me all through. So there is no point where you are left stranded and you don't know what to do. So even when you don't have a live class on Saturday, all right, so it's not Saturday, it's on a Monday, or it's on a Thursday, or it's on a Friday, you can book a drop-in session. and somebody will jump on that call with you, look at the things you are working on, give you guidance, solve problems for you. And that's something you don't get anywhere. All right. And every Thursdays in the evenings, we have our mentorship session for 1 hour. Thursdays, 10 a.m. to 11 UK, 8 p.m. to 9 p.m. US, Canada. All right. So Thursdays, you have your mentorship session where you get myself, the co-founder, we bring in industry experts within the sector to come hold your hands, answer questions, and so on and so forth. Okay. So how do you start? For those of you that want to start today, what do you need to do? I've talked about Ikmat, and I would love to play Ikmat's video. I want you to listen to Ikmat. Okay. Her journey from a stay-at-home mom who had a 2-year employment gap, but today she works as a healthcare data analyst in the form of an information analyst with the NHS. Okay, I want you to listen to Ikmat's story, and then I'll show you exactly what you need to start today. And we'll take questions and would call it a day. But let's listen to Ikmat very quickly, and then I'll come back to start to wrap up our session. Okay, so let's listen to Ikmat's story. It's a 3-minute video, but very interesting and exciting. I want you to listen to how Ikmat was able to get this job, came with sponsorship, doing amazingly well for herself, even while she was still in school. So she got the job just before she completed her master's, and that's something very important. Some people, you've gone for your master's in the UK, in the US, you're in Canada, for example, and you wait until you are done without thinking, what will I do and how will I get a job when I'm done with school? Okay, so it's always important to be as proactive as possible. Ikmat was proactive, and she realized that what she was learning during her master's did not have the type of skills and requirements that she saw on job boards. And that was why she jumped into the healthcare data analytics program. And here she is today. Listen and enjoy Ikmat's story.
Hi everyone, my name is Ikmat, and I was with the March cohort in Analytics, and joining Analytics has been the best decision so far. For me, someone coming from a background of full housewife, because I had to stay back home to look after my child for 4 years, and then wanting to break into something new, wanting to go back into the workforce, wanting to place myself in the society for better job opportunities. So it was a lot, and then I'm glad that Analytics came along, and then they presented me with so many opportunities right in front of me, better opportunities, and then I'm glad I took it. And then also the advice of do not sell yourself short, that Effie is always saying, it is very, very valid, because place yourself right, don't sell yourself short. It's a very, very, very valid advice. In Analytics, they will hold your hands like a child, through the modules. You have the opportunity to go back and study. You have the opportunity to go back and practice. You have the opportunity to ask questions. We have people you can always go back to, even outside of class hours. It's the most amazing experience so far, really. And then another thing is the interview prep, guys. That is another very important thing. I did my interview prep with Mr. Mohammed, and it is the best decision ever, because it was like he saw into the future. He knew what was going to be asked, and I'm glad that I wrote down all the things he mentioned. I went back to practice, and then when it was time for the interview, it was like everything he mentioned, they kept on. And then when I was answering those questions, I was so confident, because I already practiced. I did an Excel test, I did a maths test, and then they were really impressed. And another thing is, guys, it may not come as fast as you expect. Definitely you are going to get some no's, and then you may begin to think you're not good enough. You are good enough, yes. The no's will come, but always take it as a basis for learning and development, because after every interview where I got a no, I always make sure I get a personal feedback. So I work on those feedbacks for my next interviews, and yes, it worked. It really worked for me, because I got my first job 3 months into the program, my first job. But I couldn't take up the job because I was a student and I was only eligible to work 20 hours. So I couldn't take up the job. 3 months later, I got 2 jobs with full visa sponsorship. And guys, all the other no's before the 2 jobs prepared me for the yeses I got. So yes, the no's will come, but do not give up because you always have the analytics to go back to. They are the best and the best thing that's ever happened to me. And then yes, and they are the most affordable, the most affordable one I've come across so far, and that's a very good advantage. So yes, analytics for the win.
So that's Ikmat, phenomenal lady doing amazingly well for herself. Okay, you listen to Ikmat. She said when she got prepped for the interview and she got into the room, I was listening to the questions they asked her. It was as if the person that prepped her for that interview had seen into the future. And that's what we do. So we don't just prep you arbitrarily or generally, generic preparation. No, we look at the job description. We look at the CV you've used to apply, and we use that as a basis to come up with the questions you're likely going to be asked and prep you on how to answer those questions. Okay. Um, so the question is, somebody asked, what if I miss a class on a Saturday? So if you miss a live class on a Saturday, you don't have any problem. Okay. So what do? You have access to the class recording. Okay. So let's take, for example, you miss a class. This is a Power BI class. You miss this class. Everything is there. You have the class recording. All you have to do is go in there, click on the class recording, and you have access to watch everything that happened in class on that day, step by step. How did they get their data? How did they, bring the data into Power BI? And you see everything that was done until the end of that particular session. So the recordings are there, the class materials are there, the case studies are there. So this was a case study they worked on in that particular class. So you come in here, it's for St. Augustine General Hospital. They solved the problem for this hospital that had issues with their data modeling using Power BI. So use Power BI to build a data model for them. You get your data from a cloud database, um, Amazon S3 buckets. You'd utilize that to get your data from there. Okay. And that's how you know what to do when you get that job eventually. All right. And if you are watching the recording and there is something you're not very clear on, you need support. What do? You book a drop-in session. So you don't have to wait until the next class before you are able to get support and get all the issues you have clarified. All right. And somebody is asking, oh, is it just the UK? No, it's not just the UK. There's so many other professionals, and I'm going to share some of them with you, but we can't bring everybody and showcase every single success story, but I'll show you where to get more success stories. This is Abigail, for example. Abigail is a care worker. She worked in Saskatchewan, Canada as a care worker when she moved from Nigeria to Canada. No experience in tech. She joined our healthcare business analysis program, and today Abigail works as a supervisor, business services, and data analytics for the Alberta government. Okay, so that's Abigail, for example. You have somebody like Pavel. Pavel works in the US as a healthcare data reporting analyst with the Arizona community physician. Moved from Cameroon, where he had a background in education. He taught in a high school in Cameroon. He was a teacher, moved to the US. Today, he's a healthcare data reporting analyst with the Arizona community physicians. So the participants get jobs across multiple regions, and so on and so forth, just to answer the question for the person that asked. Now, I'm going to end with this before I show you how to go ahead and register for any of the 3 programs you're interested in. You can't stay where you are. You can't remain where you are. You have to make a change in 2026. And the question you need to ask yourself, I asked myself this question 13 years ago before I made that jump. Are you happy with where you are today? If you have that thing in your mind, I want to change, I want to get a career path, I want to move into a career path where I can work from home, I can work remotely, I can see a projection of where I can get to in the next 5 years, the next 10 years, and so on. Are you happy with where you are? If you are doing bedside care, you want to move from bedside, you want to get a job where you can analyze data, churn out reports as a healthcare data analyst. You can manage projects for the hospital as a healthcare project manager, or you can help the hospital improve the processes within the hospital where you work currently as a healthcare business analyst. Are you happy where you are? The next cohort starts on the 9th of May 2026. And this is the best time for you to get into this cohort. So what does it take for you to start and be a part of the May 9th cohort? So depending on any of the programs you want to join, the data analyst, the healthcare business analyst, or the healthcare project manager, the original fee is $1,250. But I have a discount for just 60 people, 20 across each program. So if you are the first 20 to register for the healthcare data analyst program, you get this discount. If you are the first 20 for the healthcare business analyst, you also take advantage of this discount. And same for the healthcare project manager. So I have just 60 slots available for the discounts. Okay. So what that means is to take advantage of the discount, instead of paying $1,250, you get to pay $1,000. And I'm going to break it down based on the currency. This is US dollars. If you're paying in Canadian, if you're paying in pounds, what would the fees look like? So you have a 20% off right off the bat. Instead of $1,250, if you're one of the first 20, you get to pay just $1,000. And how do you take advantage of the discounts? I'm going to walk you through that very quickly. So we have about over 200 people. So one thing I always get after a session like this is, oh, I tried to pay and I saw that the fees had increased. You are not one of the first 20. So you want to ensure that if this is something you want to do, you want to make that change in your career, you want to take advantage and be one of the first 20. So one thing would also add to as an offer is for those of you, the 60 people that pay on the call before I wrap up today, you also get a one-on-one conversation with a career coach. So before the end of the week, from Monday to Friday, somebody would call you and all the questions. Oh, I registered for the healthcare business analyst. I'm not entirely sure. This is the career path I'm considering. This is my past experience, and so on and so forth. You get a call from a career coach. They answer all your questions one on one, and then you have everything, all the clarity you need to get started. So, how do you register? I'll walk you through that very quickly in the next 5 minutes, and then we'll take questions. All right. So, my colleagues would share the link in the chat. So if you click on that link, it brings you into all the programs you can register for. Okay. So if you come to start learning, for example, you'd see become a health tech analyst. This is the healthcare data analyst program. You'd see become a health tech agile project manager. This is the healthcare project management program. And you'd also see become a healthcare business analyst. If you click on view all courses, it would show you all the courses clearly. Okay. So I can either choose the health tech analyst if I want to go for the healthcare data analyst program, and I click on enroll. Okay. You click on enroll. And once you click on enroll, you'll be required to create an account. Okay. I'm going to show you exactly, because I've created an account, it brought me here directly. But if you don't have an account, you'll be required to create an account. You enter your name, you enter your email, You select terms and conditions. I'm still going to show you how that plays out so that you know exactly what to do. Okay. So when you create an account, it brings you here. Okay. So when you get here, you can select the cohort that you are interested in. Okay. So let me quickly show you how that plays out so that you know exactly what to do. So you see exactly what I'll show you when you try to register. Okay. So, okay. So when you click on the link, it's going to take you to where you'd see all the different programs and you'd see what that looks like in the next 5 seconds. Right? So it brings you here, you view all courses, you want to register for, let's say, the healthcare business analysis, you click on enroll. Once you click on enroll again, it will require you to create an account. Okay, so I can come in here, enter my full name, enter my email. Okay, so I'm going to take an email, I'll paste it there, and I'll enter your phone number because you'll also be required to confirm your phone number. Okay, so enter your phone number, select I have read the terms and conditions, and of course, you go ahead to create your profile. So sign up. So the moment you sign up, you have an account created. You can then see when you want to start. Do you want to start in May or you want to start in June? So the beauty about this is if you you can take advantage of the discounts, but you're not free in May. You want to start in June. You still enjoy the discount as one of the first 20 people, and you can move your program to start in June if you want to start in June. But for those of you that want to start immediately in the month of May, you select May, and then you'd see the different payment plans. So you'd see that you have the 20% discount already embedded into the most flexible option where you can also make payments in 5 installments. Okay. So rather than paying a one-time payment, I can pay in 5 installments. So if I select this option, it means instead of paying £1,000 once, I get to pay $1,000, I beg your pardon. I can pay $200 per month for 5 months. So what it takes for me to start my journey is only $200. Once I pay the 200, I start on the 9th of May. So 8th of May is on Friday. We ensure everything is done. You are ready to get started. And your first class is on Saturday, the 9th of May. Okay. So, and you can change this to euros, to pounds, depending. If I change it to pounds, it means what it takes for me to start. If I want to make 5 monthly payments is £153. But I can also pay in 2 installments and I get additional discounts. So if I pay in 2 installments, it means that instead of paying £957, I get to pay just £690. But I make that payment in 2 installments. I paid $345 to start in May, and I make the second payment the month after. And if I'm making a one-time payment, I even get to save more. I get to save a whopping £306 because instead of paying 957, I get to pay just £651. So a one-time payment saves you the most. That's the best value you tend to get. And the most flexible is the 5 monthly installments. All right. So you have that flexibility depending on how you want to start. So let's say I select the 5 monthly payments, for example. I can I would see that I get to pay just £153 to start, and I can make subsequent payments later in the next 4 months. Okay, so I confirm my information is correct. I've read the terms and conditions, and I click on pay. Okay, so I confirm all my details, my phone number, my email, and so on, and I click on pay now. And this takes me into where I get to enter my card details and so on. So I'll just enter that quickly so you see what it looks like. Okay. So enter all these details, Adaiza, and then I click on pay. So the moment I click on pay and my payment is confirmed, I'll be required to get an OTP from my email. Okay. So if you don't find the OTP, make sure you go to your spam or your junk folder. All right. So it's telling me my sign up is complete and so on. And yeah, this is where I get to fill my details. I complete my setup. So I've registered for the HealthTech business analysis. Cohort starts 8th of May on Friday, which is where everything has to be set on Friday. And on Saturday, you have your first class. So I enter my detail, United Kingdom, gender, male. I enter my phone number. So based on the country you selected, you'll be asked to fill in your number. So let me select a difference. I'll just enter this number. Okay, time zone. When would you like to start? So I'm going to use the mountain time zone depending on your location. So if you're in the UK, you want to select BST. If you're in the US, you want to select Eastern time. Okay, preferred time class. I want to join classes 10 a.m. to 1 p.m. Okay, how did you find out about us? You select how did you find out? Oh, I saw you on Instagram. Okay, you can enter your LinkedIn profile, click on next. I need to verify my phone number and also verify my email. So I'll do that very quickly. So these are the things you'd also get to do when you register. And I'm just walking you through so you know exactly what is expected. I've seen about 6 payments have come in so far. So I have 54 slots available. So 54 slots available. 6 people have made payments so far. So I verify my phone number and I would also verify my email. So the email, an OTP would be sent. Go to your email, check for the OTP, and I'll just enter mine 397062. Verify email. And once I've done that, I can move forward. I'd also be required to upload my photo. Okay. But maybe I want to do that later. I'll just go forward with that. And this gives me access into my onboarding. So I start with my onboarding. Your onboarding is where you get to see all your facilitators, you get to watch some introduction videos, and so on and so forth. Okay. So this gives you access, and that's me right there welcoming you into the program. So you complete your onboarding and get access to the LMS. Okay. And that's how you register. For those of you that will be registering and getting your journey started either in May or in June. Okay. So I have about 12 payments so far, and I'll be waiting for those of you. I'll check into the chat and see if you have questions, and I'll take all the questions that you have. All right. Remember, one of the things that come with you being one of the first 20 is you also get the opportunity to join a one-on-one session with a career coach where they help you answer all the questions that you have in case you have any confusion and so on and so forth. So I'm going to take questions before we wrap up today. So if you have questions for me, please stay back and I'll take as many questions as possible. Apart from these payments, will there be any payment for projects or anything else? No. No extra payments, nothing else for no other hidden fees, no other payments. This is what gets you into the program. $200, £153, depending on where you're registering from, and that gets you into class. If you've selected the 5 monthly payments, you make the next payment the subsequent months. Okay. Can we ask verbal questions? Absolutely. I'm going to allow you on mute, but before I do that, Said, I'll take some questions from the chat. I'm in Ireland. I want a physical class. I have no background. We don't have physical classes, Sonny. All right. And that's the irony. A lot of people want to work remotely, but you want to attend a physical class. Okay. So we have participants from across the globe, from UAE, from Africa, Nigeria, Ghana, across the globe, from the US to the UK, and so on and so forth. Having a physical class is not practical. So you live in a world today where you can get access to the best of the best at the comfort of your home. Okay. And that's one of the advantages you get. Sonny joining us today from Ireland. Eunice is saying that I'm trying to pay, but it keeps telling me unauthenticated. Okay, so Eunice, make sure you use the link shared by my colleague Daniela on the call. Okay. Sh- what about internship? There's no internship payment. Like I said, the discounted fee of $1,000 covers everything we've spoken about today, your learning, your internship, and everything we've discussed. Now, for those who pay, you don't fall into one of the first 20 people to register. Then you get to pay the full amount of 1,250. Okay, so instead of paying, if you take the 5 monthly payments, for example, instead of $200 per month, you get to pay $250 per month. Okay, Sonny saying, I want to go for healthcare analyst slash project management. So start with one, first of all, Sonny. Pay for one, and then would have in the coming week, would have a one-on-one call with you and would guide you on if you should go for the healthcare project management or you stick with the healthcare data analyst program. Okay, but you need to make sure you are one of the first 20. Take advantage of the discount and register for one. You can't do two programs at the same time. Okay, so you have to start with one. So lock down the discount, Sonny, and then we'll have a one-on-one call with you this week. Okay, so Nachi shared something in the chat. Become a data analyst. Yes, Nachi, that's just go ahead and click on enroll and just follow the process. It's intuitive. Okay, just follow the process step by step, and that would get you to where I am only seeing health tech analytics. Okay, that's the question. So Daniela would help you out to solve that problem. On Nachi, what you can also do so that you are not late to register, I am one of the first 20. We have 24 payments in already. Okay, 24 people have registered. So I have just 36 slots left. So Nachi, pay for the health tech analytics, the one you can see at the moment, pay for it, and then you can always switch afterwards. When our career coach reaches out to you for a one-on-one, you can make the change seamlessly. So we organize that for you. Okay. Temi is saying, I'm struggling to enroll. Page is not opening at all. All right. Yeah, Olayinka is saying, I have done a program like this before, not the same length of time, but after the program, there was no support at all. It was radio silence. Obviously, the team had to focus on a new cohort. How, how do I know it will not be the same? So, one of the ladies, I spoke with a lady over the week. I think that was on Friday, yesterday actually. So she was one of the people that took advantage of the one-on-one sessions. And one of the things she said when she booked a session with me yesterday was she had the money to pay for the full payment. Okay, she joined us from the UK. She had the money to make the full payment, but she said she did not because she had joined a program like this before and she was no support whatsoever. So she was skeptical. Is this the right place for me to join? Should I do this or not? She didn't know what to do. So she said, okay, let me even do the 5 installments. Let me pay once for the first month. And if it is not what I want, then I don't have to make the second payment. But guess what? I had a conversation with her yesterday and she was like, she's so happy and she wishes she had made a one-time payment so she would have gotten additional discounts because what she has today, the support she's getting, she's super excited. And she told me something interesting. She registered for the healthcare business analysis program, and she said on her vision board for 2026, she wants to get a job as a healthcare business analyst with a salary of at least £50,000. And we laughed about it. And I was like, why don't you increase it to 55 at least? And unfortunately for her, the reason why she registered was because she was 3 years into her ILR, and the license of her sponsor got revoked. So she was in a limbo. She didn't know what to do. And then she got to register. She's currently on the program, doing amazingly well for herself. All right. So one of the things I'll tell you for free, for the lady that asked the question, let me just check one more time. Olayinka, is we don't do a become a healthcare business analyst in 2 weeks or 3 weeks. No, this is a full-fledged program for 6 months. And we are also accredited by the CPD. So we've gone through all the standards in terms of delivery. So when you get your certificate, it would have the CPD accreditation on it. And do you know what that means? It means that for you, you've gained skills in a career path that is accredited by the CPD in the UK. Okay. So all the support you need, like I said, you don't need to even call anybody or send a message to anyone. Just go to your classroom and book a drop-in session any day of the week, and somebody will jump on a call to help you address any issues. For those of you that register, you'd be in a Google Classroom, you'd be on the LMS, and you'd also be in a WhatsApp group. So if you're on the LMS, for example, I'll show you what that looks like. Um, so this is where you book your drop-in session, Olayinka. So you can come in here. I don't need to speak to Ades. I don't need to call anybody. Oh, maybe there's radio silence. I don't really care. I want to speak to somebody on a Monday. I come in here, I click on this link, I select my preferred timing, and I get to book a session. Okay. I want to book a session even next month in May. I can book a session on the 29th, on the 26th, on a Tuesday, and I can have a conversation with somebody. Or I can go to my classroom and you have a support chat. I can come here and chat and somebody responds to me. Okay. Looking for something. There is somebody here 24/7 to respond to questions. So if you're not getting your questions answered immediately, there is someone here. You come in here, you chat, and somebody responds to you. Another thing you also have is you have access to your facilitators. So all your facilitators, depending on the program you've registered for, are all here as well. So here I have Mary. Mary is the team lead for HR and financial analytics. I can chat with Mary directly on my LMS. And there's a WhatsApp group in addition. So you have every single avenue to get support. You have them right within your fingertips. And that's what makes us stand out at Analytics. All right. So I talked about the CPD accreditation, and we're also accredited by the American Council for Training and Development. So when you get my slides, if you click on this link, it takes you to the accreditation. You'd see Tenalytics, our CPD number, and also the American Council of Training and Development. Okay. So Olayinka, you have nothing to worry about, nothing to fret about. And I know the experience of so many people. Become a business analyst in 2 weeks, in 3 weeks. You've written all the certifications in the world, but you still cannot land a job. And that's why one of the first things we tell you at Analytics is forget about all the certifications you think you know. We don't deal and advise on certifications. What do we advise on? Competence. Okay, sorry, I want to write that down. So you take a note of that, Olayinka. Competence over credentials. So you have a master's, you have a degree, you have a PhD, you have this, you have that. Just put it somewhere, forget about it. And what do you focus on? your competence. Because employers don't hire you for your credentials. Nobody cares that you have that master's. Nobody cares you have that certificate because anybody can pass a certification exam. But your competence comprises of what? Your skills and your experience. So that's the mantra we live by at Analytics. Okay. So I hope that helps, Olayinka. Let me take a question from Saeed. I think Saeed wants to unmute and speak. So I'm going to take a question from Saeed. But just before I do that, I want to check to see how many slots I have left. And then I'm going to call upon Saeed to ask his question. Okay, I have 14 slots left. Okay, so I have 46 people who have registered across the different programs, and I have 14 slots left. Okay, so out of the 150 of you, if this is something you want to do, like I said, make sure take advantage of the discount. How often is the live class? Saturdays is when you have your live classes, Sunny. Saturdays. You don't have live classes any day outside Saturday. Saturdays when you have your live class because we know that you are all professionals. You have your day job or your night job, depending on what you do, and you have to go to work. Okay. So, Daniela, do you want to stop the recording so we don't have a video that is too long as we take questions?